Hi, I'm Dr. John Russo. As a disclosure, I'm on the Board of Trustees for the American Academy of Periodontology, so this presentation does not necessarily represent the views of the board or the views of the AAP. The product I want to talk to you about today is a new product from Salvin Dental called AmnioExcite. It's amnion and chorion plus a trophoblast layer. The trophoblast layer contains more than 50% of the biologically relevant proteins in the placental membrane. As we look at the membrane separated, this is what the AmnioExcite looks like. There are three layers. You have the amnion, the chorion, and the trophoblast layer. So you can see this would be thicker than these two layers alone. Clinically, what you'll find is that the membrane doesn't fold on itself when it's rehydrated, so it's much easier to handle. It's twice as thick as an amnion-chorion membrane by itself, so it's a better protective barrier, and it's decellularized to remove potentially immunogenic cells. The case I want to show you today is tooth number 13 that had gross decay, and although it was restorable, in this particular situation, due to the patient's hygiene and likelihood for recurrent decay, and a 3-unit bridge, we decided it was better to extract number 13 and perform a socket preservation. So the patient's an 81-year-old retired physician who's had a kidney transplant. He's taking anti-rejection drugs for that. He's got heart disease with a history of bypass, and he's diabetic. What you're going to see in the upcoming video is the placement of a mineralized cancellous and mineralized cortical allograft, which is a LifeNet product from Salvin Dental, and it's called Orograft. And I'm also going to use the AmnioExcite as I would a PTFE membrane. In this particular situation, I thought there was value in this patient's medical history in getting growth factors from the AmnioExcite, and I'm not too concerned because it's a thicker membrane and I know it's going to contain the graft material. So we want to trim this dry and then place it dry. And let it hydrate. Then we're going to tuck it underneath the palatal flap, like that. And then we'll suture it. So this is what the case looked like after it was sutured up. Here's the membrane tucked under the palatal and on the buccal. The video you just watched was the extraction and socket preservation of a patient that was not in the best of health. I chose to use the AmnioExcite for its handling characteristics as well as the benefit of growth factors with a compromised medical history. What I observed at the 1-week post-op is the membrane was still intact where I intentionally left it exposed, and in 2 weeks, the membrane had resorbed where I left it exposed, but all the graft material was intact. So it stayed around long enough to do its job and contain the graft material, and also we benefited from the growth factors. So I'm very optimistic about using the new AmnioExcite, and I've been working with Salvin for 20 years in education. They're a great group of people. I would encourage you to try this membrane. Give the team a call at Salvin Dental and give it a try.